Hey everybody out on YouTube, this is Deegan, and this is my pre-op video. I am getting top surgery I'm scheduled to go in about 10 hours. I'm having surgery with Dr. Robert Tuckler in Irvine, California, and it's through my insurance, which is Kaiser. I just wanted to talk to you guys a little bit about what I learned and um, some of the technical things that I've been told, and um, just kind of be an informative video. So I want to start off with what I'm getting. The technical terms. Hold on. I'm having. I was kind of close. Bilateral partial mastectomy through crease incision with nipple areola grafting, possible trunk suction assisted or ultrasound assisted lipectomy. And basically, that is a bilateral partial mastectomy with nipple grafting and possible liposuction. Okay. So it's with, again, Robert Tuckler. It's Tuchler. It's fully covered through my insurance, which is Kaiser. My copay is $10. And so starting off with my pre-op appointment with Dr. Tuckler, I was told that he wanted me to stop taking tea because of the thickening of my blood and the possibilities of clotting during surgery. I was not aware that you are supposed to stop taking tea. I don't ever remember coming across a video or talking to anybody about that, so that was a big shocker. I stopped taking it. He wanted me to stop taking it, I think, 4 to 6 weeks prior to my surgery, but I was on a cancellation list, and so I've been off tea for 2 weeks, and it has definitely affected me. I have found myself to be withdrawn, flooded with emotions that are really hard for me to control. I've felt disconnected. My anxiety's kicked back in. It has caused me to react to certain situations kind of erratically and very emotional. Gotten into some arguments with my fiance that I normally would not have. So I'm definitely feeling the effects. I don't have and I've had a headache for 4 days. And I'm extremely tired. I also just feel sluggish. I know something's not right. It doesn't feel right in my body. It doesn't feel right in my head. So there's that. So be aware that you're gonna be told to not take tea. And then I can have my first injection 1 week after the surgery. So that will be next Wednesday. And then I will have been 3 weeks off of testosterone. I can't wait to get back on it. Let's see what else. I check in at 5:30 a.m. and my surgery is scheduled for 7:30. He scheduled a 4-hour block with a 1.5 hour post-op recovery. And I was showed how to use the drains today if I'm going to need them. So with Dr. Tuckler, he knows more once he goes in. So some guys have drains, some guys don't. I was happy to find out today that where my crease line is on my chest, he's not going to have to go as far back towards my armpit area, so that was really nice. And they gave me a prescription for Norco, which I haven't decided if I'm gonna fill or not. I may go an alternate medicinal route and see how that works. Not really big into popping pills, so I'm gonna see. Oh, I also kind of same stuff that you already have probably read, watched, heard. The drains, if I have them, can come out as soon as my body produces under 30 mLs of fluid in a 48 hours time span. And so as soon as that happens, then my drains will be able to be removed. So it's usually around 7 days, but it could be earlier, it could be later. It all depends on how my body's going to heal. Aftercare, I was told, this is what you probably already heard, I was told that I'll be in some type of either compression vest or some type of dressing with, kind of like an ACE bandage wrap for 7 days, and then day 7, so on the 27th, I have my post-op, and that's when I'll be able to see my chest for the first time, and all the dressings will have my first dressing change. How do I feel underneath all of it? I am a little nervous, and it's not for going under. I'm just really sensitive to anesthesia, and I throw up and get super sick, and I don't want to go through that, and I shake really bad, and my fiance is very sensitive to vomit, so I have that. But I'm hoping that I can get some type of medication in my IV when I wake up to help me with that. We are staying here in Irvine. We're staying over by Disneyland. So we're staying in Anaheim in a hotel for today and tomorrow, and then we're going to drive back to San Diego. Why I chose Dr. Tuckler over another Kaiser surgeon, which was Dr. McMillan. I started off with looking at pictures and results from both of them. I liked Dr. Tuckler's work better. I also spoke to a couple guys, but one guy that I had multiple conversations with, which is Carter Ray. I think you can find him at Carter Ray on Instagram. He had Dr. Tuckler. His results are amazing. I know it's case by case, but he really just turned me on to Tuckler because of the way he said how Tuckler's staff and how Tuckler treated him. I couldn't say anything bad about Dr. Tuckler or his staff. They have been so respectful. Dr. Tuckler and his staff have amazing bedside manner. Today I had to have pictures of my chest taken, so fully exposed, top up, and Tuckler was so nice. He was very respectful. He was just kind. His nurse never looked at me one time. She had her head turned the whole entire time she held my gown. They, call you by your right pronouns. They call you by your right name. Dr. Tuckler mentioned a couple times, he apologized that this was going to be uncomfortable and a little embarrassing to take the pictures, and that he would get it, done as quickly as possible. He was very thorough. He took his time. I didn't feel like I was being rushed with the questions that I asked him. He explained everything in detail. Told me again he would explain some more to me, day of surgery, and I got a great vibe from him, and I think that you need to have that when you're going to have any type of procedures done, whether, it's major surgery or getting your teeth cleaned. You need to be able to really vibe with the person that you're going to trust your life with, So that was really good. I am more so, I'm anxious. I'm really anxious. I'm getting to the point where I just want it to be done. Let's just go. Let's get it in. And get in there and get it done with. healing process going. But yeah, I feel better. I feel content. I feel calm, and I'm ready for this piece of my puzzle to be placed, and I can start living my life, another part of it, the way that I see it fit. So I hope I covered everything. I'm going to make a post-op video whenever I feel up to it. Um, but thank you everybody for watching. I hope this gave you guys some information. If you are researching surgeons and you have Kaiser, please check out Dr. Robert Tuckler, Tuchler, in Irvine, California. I think he's on like TransBucket, and I don't know. You can look me up on Instagram. It's Reiki Tiki Tabby, or you can look up Carter Ray, or even type in on Instagram Tuckler or Robert Tuckler, and I'm sure some pictures will come up. So thank you again for watching. I hope this gave everybody some information. I appreciate all of you that have been following my journey, and I will be talking to you guys in a couple days. So please have me in your thoughts and your prayers, and you guys all have a good night.